hard to follow Delilah, who is walking the walk. Das all seeds of literacy asking me long make them clear this spell is something all they call them health literacy. In year 2007, American Dr. Bung talk save now good health literacy. I mean, number one something by bagarapim health belong man Mary people hamas years belong you, na hamas kina belong you, na suppose you got work or schoolum or one'em kind skin you got. When teaching, I like to give an experience in what I'm teaching to those who are listening. I gave you an experience in what it's like to not understand what is being said by a doctor. You may have experienced something like that in not too dissimilar in a doctor's appointment you may have had recently. I am a doctor, and unless you understand Melanesian Pidgin English, the trade language in Papua New Guinea, you probably didn't understand many of the words I just said. So let me tell you what I said. Good afternoon, everyone. It is hard to follow Delilah, who is walking the walk. However, Seeds of Literacy asked me to explain a little bit about health literacy. In 2007, the American Medical Association asserted that poor health literacy is a stronger predictor of a person's health than age, income, employment status, education level, or race. End of translation. I first became interested in literacy, and more specifically health literacy, as a Peace Corps volunteer in Papua New Guinea in the late 1980s. I was tasked with creating and implementing health educational materials for pre-literate people. Even though Melanesian Pidgin English was spoken in the remote district of New Guinea that I worked in, most mothers, who were my target audience for the health messages, spoke their local language, but not Pidgin English. And most of the local languages had not been written down, let alone have an alphabet to be able to write them down. They were pre-literate. So I spent a lot of time thinking about how to communicate health topics to people who do not read. Eventually, I settled on creating dramas and using hand puppets because storytelling is a national pastime in Papua New Guinea. Upon completing my Peace Corps service, I entered medical school. And during the summer between my first and second year of medical school, I worked in a rural community health center with several family medicine doctors, and I was asked to write health educational materials about various chronic medical problems. The target audience for these pamphlets were patients who had a 5th grade level or lower of reading ability. Still in this country, most health education materials are written at a 9th grade reading level, despite the fact that approximately 20% of Americans read at or below the 5th grade level. The goal of the health education pamphlets was to help patients understand better their medical conditions and the reasons they should take the medications they were prescribed. I learned a lot about the importance of writing short sentences with words containing the fewest syllables and avoiding all medical jargon. Health literacy has remained a focus of my medical career. Most notably, for today's presentation, I want to highlight the fact that I've had the pleasure of presenting this topic with the immense help of Seeds of Literacy graduate Maria Rodriguez, who is not here today. For the last 10 years, we have co-taught first-year medical students, the entire class, at Case Western Reserve School of Medicine. So Seeds of Literacy has had a direct impact on the last 10 graduating classes from the Case School of Medicine, helping them understand the importance of literacy and specifically health literacy in their patients' lives. And why is that important? In keeping with my storytelling days in New Guinea, let me tell you the story of a patient I met 14 years ago. He still is a patient of mine. He lived the story I am going to read to you, but I wrote it for him for reasons you will understand as you listen. Before it was published, it was read to him to see if he approved of the style in which it was written, as well as the truth of the content. After listening to his story, he said, "I want you to publish it so that others can learn from what I have lived." It was subsequently published in an anthology that is used to teach medical students and other health professional students about equity in healthcare, because health literacy is a recognized health equity issue. I warn you that I sometimes get emotional reading this story, and I also warn you that when I present a talk, in addition to giving an experience, I like to engage the audience to participate. So as I tell you this story, you may want to jot down a few examples here of what you are listening to, because I may ask questions afterwards. So listen for institutional racism. Listen for perseverance. Listen to how people obtain information. Listen to how people memorize, how they develop coping mechanisms, how people develop workarounds, intelligence, hard work, doctor shopping, non-adherence, healthcare bias, creative problem solving. My name is W.B. I grew up in the Deep South in the 1950s. Jim Crow told me what to do. I was born into a family of 8. My brothers and sisters were older. I didn't go to school. When I was old enough to start school, all my brothers and sisters were already working in the fields. There was no one to walk me to school. Mama didn't want me to walk alone when I was small. I wanted to go to school. I wanted to go badly. And I got my chance when I was bigger. I walked alone. That was hard. But my teacher was harder. Why did he expect me to know all this stuff? I started school late. He hit me on the head when I gave a wrong answer. So I started not answering. I came late. Then I stopped going. I went to the fields. No, I never learned in school. I never learned to read. I never learned to write. I did learn my numbers, though. I had to count the bales. I learned how to drive. I left where I grew up my first chance. Drove right up to Cleveland. I got a job as a truck driver delivering meat. I didn't start as the driver. I started as the helper. I could lift those cows. I could throw those boxes of meat in the truck. I learned the streets real good. I couldn't tell you the names from the signs, but my driver told me the names. I learned the names of all the people and places we delivered and how to get there from him. And I could count the money. I was always real careful to count it well. When I became the driver, I drove all over Cleveland delivering the meat. My boss knew he could depend on me. I worked for that company for 20 years. I had a family. I made sure they all went to school. Nobody knew I couldn't read. Not my boss, not my kids. I knew. I tried to learn through one of those programs. It didn't work. I figured if I made it this long not knowing, I should be fine. But then I had headaches and went to see a doctor who told me my blood was high. He told me I had to take medicine to lower it. I didn't know why. I didn't ask. I didn't like what the medicine did to me, so I didn't take it. I went to that doctor for a year. Every time I went, he said my blood was still too high, and he added more medicine. He kept giving me more medicine, and sometimes I took it. Sometimes I didn't. I wanted a new doctor. I found a new doctor. I saw the new doctor for a while. He told me the pressure in my arteries was like the pressure in a tire. If it went too high in a tire, I knew what happened. He said if my blood went too high, my blood pressure went too high, it could explode in my brain and give me a stroke. I know what that is. I have friends who can't walk because of that. I took my medicine. My pressure was still too high. My doc asked me one day to bring my medicine with me to the next appointment. I forgot for a long time. When I came in that day with it, I knew what was going to happen. I walked up to the lady at the desk. She handed me a paper I couldn't read. She always handed me this from the first time I came to see this doctor. I always took it. I never told her I couldn't read. Then she told me to drop it in the slot in the door. I always did that. Then the nurse called me back and asked me a bunch of questions. Just like before, she never asked me if I could read. Just if anyone was hurting me or if I had any falls. She took the paper from me and wrote some things on it and told me to go back to the lobby. She never asked me if someone helped me understand what my doctor wants me to do. I would have told her about my girlfriend who reads to me. She helps me with all that stuff. I had my medicine bottle this time. My doc called my name and I went into his office. I liked this guy. I don't know why. He didn't grow up having Jim Crow tell him what to do. I doubt he ever worked in the fields. He knew how to read. He was white. I am not. He asked me to show him my medicine. I did. He asked me, like he always does, when did I take my medicine? I told him sometimes in the morning and sometimes at lunch. He asked me to read my bottle instructions, so I told him no. He said, "How do you feel about your reading?" I told him I couldn't read. I hadn't told anyone that. I don't know how I felt. He asked why I hadn't told him before. I said because I wasn't sure I wanted to tell. He said, and I guess I didn't ask. I told him why I couldn't read. He took the pills out of my bottles and we looked at each one, identifying them by shape and color, and he told me what each one was and when to take it. I started taking my medicines the way he said would help me not get a stroke. I don't know why I brought the bottle that day. I could have just gone to a new doctor. But I remember when my son started hearing things and the doctor said he needed to take medicine to stop hearing things. That doctor didn't explain to me like this doctor did with the tires. He didn't explain to my son either. So when my son stopped the medicine because it made him sleepy and he started hearing those voices again, I didn't make my son take his medicine. Then my son took someone's life because he said the voices told him to do it. Now I can only see my son when the prison visiting hours are happening, and it's a long drive to get there. Maybe that's why I brought the bottle that day. I have a daughter in the South, too. She is with my ex-wife, but she is not doing well by her. She is not going to school. I've been trying to get her to come live with me so I can get her to go to school. The lawyers send me all kinds of papers to fill out. My girlfriend helps me with those, too. Someday I hope my daughter will come to be with me. Maybe that's why I brought the bottle in. I don't want to be paralyzed when my daughter comes to live with me. There are just multiple examples in there of the problem that low health literacy creates. I'm not going to ask you questions because I think I'm running out of time here. But I lost my place. Yes, so I will conclude by saying to you that the work you support of Seeds of Literacy plays a vital role in changing lives for the better, not only because people learn to read, but because they become empowered in so many ways, and that empowerment allows them to improve their health. When I do this talk with Maria Rodriguez, we talk about the difference in her approach to doctors before and after she learned to read. She is now a healthcare advocate for many people in her family and neighborhood. She who was once too afraid to ask a question of her doctors. So I encourage you all to keep the work of Seeds of Literacy going, as it's a work of equity, it's a work of inspiration, it's a work of empowerment. Thank you.